So as Lynn said, my name is Leanne Phillip, and I am in the Bachelor of Arts Health and Community Services program. Today I'm presenting my case study that I performed with the Vancouver Island Health Authority, or Island Health. Oh, there we go. Okay. So within Island Health, I worked in the Department of Home and Community Care alongside the Community Resource Team, or CRT. This department consists of clinicians with varying backgrounds, such as nurses, social workers, occupational therapists, and so on, to provide in-home community-based services. Their goal is to improve clients' health, quality of life, and to maintain their independence. This is especially important as many of their clients are older adults. Their services support clients that have varying healthcare needs. Stages of care include acute, chronic, palliative, or rehabilitation support. My main role within this practicum was to help evaluate My Health Plan, which was recently implemented. My Health Plan is a documentation tool that clinicians fill out with clients that records the client's short and long-term goals. The idea is that this form will spark a discussion between the clinician and client around what the client wants to achieve rather than what the clinician wants. By doing so, this allows the client to feel like an equal partner when contributing towards their own health care. With this mindset, self-management and shared decision-making thrive. After documenting the client's goals, the form will then define the healthcare team and what role each individual plays. The client is considered to be a part of this team. It also records how each goal is going to be achieved, what resources are needed, and a potential timeline for when the goal will be achieved. Every time a client is visited by a clinician, the clinician is updating and adding to this form and leaving a copy with the client. This will mean that interprofessionals will be able to communicate through one form and have a constant working knowledge of the client. After learning about My Health Plan, my case was to create a cover letter and survey that would be mailed to clients all over the island that would ask for their feedback on how it's going. The rationale is to learn how effective the My Health Plan is and how to make any improvements. The first step was to create the cover letter. The cover letter first addressed the purpose of the survey to ensure that we were being as transparent as possible with the clients. The next aspect to consider was ethics. It was important to communicate to the client that their names or any identifying characteristics would not be used in the survey. Information would be protected in accordance with the BC Freedom of Information and Protection of Privacy Act. Responses would be kept confidential and participation was voluntary. Following this, there were instructions on how and when to return the survey, as well as contact information should the client have any questions. This letter ensured health literacy by using plain and simple language. The CRT was satisfied with the content, and it would be sent to Island's Health Administration team for formatting, and then to the communication board to get approval and final edits to send out. After completing the cover letter, the focus was then on the survey. The CRT ensured that issuing surveys to clients was ethically approved by Island Health's own ethics board. Following this, the CRT and I reviewed the initial intended outcomes of the My Health Plan when it was first implemented, as well as the constructs of the evaluation. This allowed us to brainstorm questions for the survey. The survey used a mixed method design using concurrent triangulation. Simply put, questions were both quantitative and qualitative, and data was collected simultaneously. Quantitatively speaking, questions use a semantic differential scale. Qualitatively speaking, questions ask for open-ended comments. Like the cover letter, the survey kept health literacy in mind by using plain and simple language. It was then formatted by administration, and edits and approval came from the communication board and CRT. So the cover letter and survey were sent to 10 clients selected at random from various health units to get their feedback on how it's going. So far, it has only been conducted in the Northern and Central Island for 2 reasons. 1, it is following the implementation pattern of the My Health Plan, and 2, it's easier to manage the incoming feedback. So what worked? I was well oriented to the My Health Plan and its rationale through previous course-related material and attending educational sessions. And I also had an abundant amount of resources through their internal site to create the cover letter and survey. With that said, as with any organization, I'm sure, resources could be hard to find, which ones were applicable. The timeline got pushed back due to workloads of other professionals, and the communication lacked at times because people were super busy, going on vacation, being sick, doing all those things. Yeah, they're sick. Yes, no, I'm kidding. Anyways, thank you so much for all of the support. My practicum supervisors, Sandy Lemmark and Manpreet Kara, the PHSP faculty and staff, and all of you. So thank you so much. Yay, we're done. Woo! I can breathe. Okay.
Thank you, Leanne. Questions for her? Yes, I'll be right there, Cassie.
The end. Yeah.
Not the end. I have a question.
Almost. Okay, almost. I'm rushing now.
Thank you, Leanne.
Yeah.
You were talking about the client being a part of it. Mm-hmm. So I guess what I was hearing, and maybe I've missed it, it sounded like various caregivers were putting information into this plan. And I was left thinking, oh, what about the fellow that it's about? Mm-hmm. What did the client actually put in it?
Did the client do? Yeah. So when a clinician consults with the client, instead of the clinician sort of taking on a traditional medical role, being like, I think we should, for that broken arm, we're going to put a cast on and we're going to do this. They're leaving it up to sort of the client being like, okay, what is your main concern? And it didn't even have to be really health related. Like, what is your main goal? So my main goal might have been, oh, John wants to eventually travel up the island to go visit his family, but can't do that because he's in a wheelchair or something like that. So the clinician would work with the client based on their own goal on how to achieve those steps. And they would involve, say, an occupational therapist to come maneuver around the house and stuff like that. Does that answer your questions? Okay, awesome.
Thank you very much. Any other questions? And if you ever get a chance to take a fitness class with her, I highly recommend it because I've seen her do it in the pool.
Oh yeah, Lynn, anytime you want to join, come right in.
I don't think I'm quite that strong yet, but I'll get to it.
Okay, we'll work on it.
Thank you
Okay,
so much.
Thanks, guys.
Good job.